Hello and welcome to our last section of types of shock. In this section, we'll be discussing distributive shock. Distributive shock occurs due to widespread vasodilatation. There are four main types of distributive shock: septic shock, anaphylactic shock, neurogenic shock, and psychogenic shock. Let's begin our discussion with anaphylactic shock. Anaphylaxis happens due to severe allergic reaction. We've already studied the signs and symptoms of allergic reaction. The patient will start to exhibit hives, rashes, wheals, difficulty in breathing, probably complete airway obstruction, might have a stridor, might have a wheeze. And this happens because the patient has been suddenly exposed to a very sensitive allergen. Patient may or may not have any previous history of allergies. So the patient says that he's never had an allergic reaction in the past. That does not mean that currently the patient would not be having an anaphylactic reaction. So what happens in anaphylaxis? Histamine is released into the body, and histamine is what causes the widespread vasodilatation. If the vessels start to dilate, there will be decreased venous return. There will be increased heart rate because the blood pressure is low. So in order to maintain the cardiac output, the heart is going to compensate with increased in heart rate, that's tachycardia. And eventually the person is going to have features of shock. How do you treat an anaphylactic shock? We studied in pharmacology. The definitive treatment for anaphylactic shock is epinephrine. What does epinephrine do? Epinephrine causes systemic vasoconstriction, so it brings back the blood into the main circulation. So this vasoconstriction, whereas histamine caused vasodilatation. So the main treatment will be epinephrine. We'll give it with an auto-injector at a dose of 0.3 milligrams. We'll give IM. Now let's talk about septic shock. Septic shock is seen in bacterial infections. Bacteria, more than viruses or anything, have certain bad toxins. These toxins can again cause systemic, or let's say widespread, vasodilatation. Okay, so if these are the vessels, they start to dilate. If they start to dilate, they start to collect more blood and less blood is received into the organs. Another thing that happens is there starts to be leakage within these vessels due to the bacterial toxins. If there is leakage, the fluid and the plasma is going to start to escape out. If the fluid and the plasma is going to start to escape out, we are going to see swelling in the body tissues. Now when this vasculature starts to leak in the pulmonary vessels, the fluid starts to fill up within the alveoli, and this causes pulmonary congestion. And overall, due to vasodilatation, there will be hypovolemia. So not only is there vasodilatation, the fluid is leaking out, eventually all of them will cause a drastic drop in the total volume of the body. How do you treat a patient with septic shock? You keep the patient warm, you continue giving oxygen to the patient at 15 liters and transport the patient urgently. You can elevate the legs of the patient in order to keep the gravity to push the blood back into the heart. So treat for shock. And immediate transport, you can call for early ALS assistance as well. Neurogenic shock. What happens in neurogenic shock? Neurogenic shock is seen in trauma situations when there has been a spine injury. Most spine injuries in the higher cervical region. What happens in neurogenic injuries? In neurogenic shock, the sympathetic nervous system gets cut. Normally the sympathetic nervous system keeps the arterial tone, so keeps the blood pressure high, keeps an increased heart rate. But when the sympathetic nervous system is injured in a higher cervical injury, you start to experience widespread loss of arterial tone. If there is no tone in the vessels will start to lax out. When they lax out, they will cause vasodilatation, eventually hypotension. The sympathetic nervous system is unable to provide compensation by increased heart rate, so you will also have a decreased heart rate. So you'll see a patient who's hypotensive with a lower heart rate, who's unable to sweat, especially below the level of the injury. In such a patient, you should be expecting neurogenic shock. How do you treat a patient with neurogenic shock? Same thing. Oxygen. Keep the patient warm. Make sure that you have immobilized the spine completely until you reach the hospital, and immediate transport. The last kind of shock is that of psychogenic shock. Now, psychogenic shock is just temporary vasodilatation which can happen in a patient due to sudden bad news or being suddenly upset about something. The temporary vasodilatation will cause the patient to have a syncopal attack. In syncopal attack, the patient will have transient loss of consciousness. When the patient falls down, when the patient is supine, the brain receives blood supply once again because of the gravitational force, and that helps a patient to regain consciousness. Most times psychogenic shock is temporary, it reverses, and there is no real outcome from there. But there probably could arise a patient who has syncopal attack but who has another injury which you need to look into. So don't just ignore a psychogenic shock, always look for further injuries. So this was all about distributive shock. Like we said, there are four main types of distributive shock: anaphylactic shock, septic shock, neurogenic shock, and psychogenic shock, where there's widespread vasodilatation of all the arterioles and the venules. So this was our last topic on types of shock. We will have one more session on the different signs and symptoms overall, and compensated and decompensated shock. Thank you.